Magandang tanghali po sa inyong lahat. Subukan po natin na i-Pilipino yung ibang mga katanungan natin sagot dahil marami po ang nakikiusap, yung ating mga kababayan na kapag nakikinig sila para mas madaling maintindihan. Of course, pwede naman both English and Filipino naman ang ating gagawin sa ngayon. Magandang tanghali sa ating regular press briefer. Maikli lamang po at konti lang ating mga anunsyo sa araw na to. Kasama pa rin po natin siyempre si Secretary Duque at ang ating pong Director ng Epidemiology Bureau na si Dr. Ferchito Abilino. Sec.
Maraming salamat, Yusek Eric, at kasama din natin ngayon ang Director ng Epidemiology Bureau. Wala iba kundi si Director Chito Avelino. At sa ngalan ng Department of Health, ako po ay bumabati sa inyo ng isang napakamagandang araw at amin pong ibahagi sa inyo na ang sa ngayon, alas 12 ngayon araw, ang DOH ay nag-uulat na meron po tayong 80 pasyente na tinagurian persons under investigation or PUIs para sa ating 2019 nCoV acute respiratory disease or ARD. Sa 80 PUIs ay 67 ang kasalukuyang naka-admit at nakahiwalay doon po sa mga ospital na kung saan may isolation room. Habang ang 10 naman ay napauwi na. Ngunit tinatawag natin strict monitoring, under strict monitoring. Ang DOH ay nag-uulat din, inuulit natin yung iniulat kahapon na umaga na may isang PUI mortality with a negative result and 2 confirmed cases with 1 mortality. Yung palang isang sinasabi ko yung una nung Thursday, yung HIV complication. Negative yon, okay? Plus yung kahapon, yung sinasabi natin, dalawa, yung isang pumanaw because of severe pneumonia. Ito pong pagtaas ng ating PUIs ay nangangahulugan na ang atin pong pagmamatsyag o surveillance ay atin nang napaunlad. So, much better surveillance system at ganoon din po ang contact tracing natin ng Epidemiology Bureau. At atin pong pinalawig din ang atin PUI category to the whole of China. So hindi lang po ito Wuhan or Hubei, kundi buong China na po. At ito pong kahapon na deklara ng ating Pangulo yung imposition ng travel ban to mainland China, including Hong Kong and Macau. No? Kasama po yan. To date, ang ating pong Research Institute for Tropical Medicine ay kinukumpirma ang 30 PUIs bilang negative for the 2019 nCoV test. Yung pong dalawa ay yung nag-test ng positive and 48 results are pending. Yung dalawa, yun na yung nauna. Okay? The Interagency Task Force for the Management of Emerging Infectious Diseases is set to meet with the President this afternoon. Kasama po rito ang iba pang mga ahensya ng pamahalaan at inanyayaan mga resource persons, mga experts sa siyensya ng infectious disease, virology. Sino ba yung kasama? Sa mga infectious disease specialists for adult and children. Para nga mapag-usapan, talakayin kung ano ba ang pinaka-mabuting mga susunod na hakbang sa pangangasiwa or case management of the 2019 nCoV ARD in the country. So muli, ang inyo pong DOH ay nananawagan sa ating pong mga kababayan, sa ating pong publiko na pairalin po natin ang tinatawag natin mga preventive measures such as proper hand washing, observance of CAF etiquette, maintaining healthy lifestyles for added resistance against infections. Maraming salamat.
May oras po tayo sa kaunting katanungan. Please. Yung sir, walang underlying conditions. Although yung nakita nga, ang nakita lang sa kanya nga yung pneumonia, pero aside from dun sa coronavirus, meron din siyang positive na Haemophilus, meron din Klebsiella. So may iba pa na mga virus at saka bacteria na nakita. Hindi siya nag-test negative previously. Ito yung first test sa kanya yung ginawa sa RITM.
Ko lang, nilawin lang natin kasi medyo baka malito Yung tinutukoy mo yung namatay. Yung namatay, batay sa RITM, meron pang dalawang mikrobyo na natuklasan doon sa pagsusuri sa ibabaw ng nCoV, meron pong Streptococcus pneumoniae, which is a common cause of community-acquired pneumonia, and also Haemophilus influenza type B. Yun lang po. Balik tatlo. Mahirap na because it's a mixed infection, mixed pathogens. So it will be very difficult which among the three. But still, we would say that the severe pneumonia must have been caused by the corona and COVID because of the clinical and some diagnostics that show similarity between the SARS-CoV and the nCoV. Yun lang.
Hindi siya tinest kasabay ng first confirmed case. Yung pinadala sa Australia na 6 noon, kasama yung dun sa babae. Hindi kasama yung sa lalaki. Yung sa lalaki tinest dito sa RITM. Pagka-set up ng labs natin.
Sir, bakit hindi po sila sabay?
Yun kasi nung unang, yung preliminary testing nila, ang mga resulta nung sa babae parang mas suggestive of nCoV. Kaya nung pwede kami magsingit ng isa, ang naisingit yung sa babae. Pero yung sa lalaki dito na tinest. Pero yun ang unang test niya for nCoV 2019.
Sir, clarification. It was mentioned that he was already, he already has fever during the time nilalagnat na raw po nung ipinasok siya sa San Lazaro Hospital. So bakit hindi yun nakita as telling na maisama yung kanyang sample dun sa unang pinadala dun sa Australia? Bakit hindi na iba? Kasi parang lumalabas na parang compared to the woman, although you mentioned na telling din yung sa babae, pero meron na rin sakit yung lalaki nung na-admit siya sa San Lazaro Hospital. Bakit hindi siya
Nakapila talaga siya. Talaga siya yung...
Apart from the fact na they are partners. So, telling na yung sa babae.
Yeah. Yung tinanong din namin sa RITM, yung kwento niyan. Kasi nung una talaga, hindi kasi sila yung mga unang mga pasyente natin. Naisabi na sa Australia na magpapadala tayo ng 6. At mahirap kasi ang coordination dahil mga infectious samples ito. So hindi ka pwedeng magiging 8 bigla or 7 ang papadala. So nung ipapadala yung 6, nakarelista na kung alin yung 6 na yon. Kaya lang nung nakita nga yung resulta nitong dalawa, mas mukhang mas malaki ang chance na mas positive yung sa babae. Doon sa lab results lang, hindi kasama yung clinical findings.
Ano yung pinakita ng babae na masasabi na mas telling yung kanya?
Merong nakitang parts ng virus na possible na coronavirus. Talaga yung test niya na initial.
What was the manifestation?
No, it wasn't clinical. Hindi clinical yung decision. It was a laboratory decision. Based on laboratory results, not on clinical results.
May dagdag lang ako. Circumstantial evidence, Tama yung sinabi niyo, magpartner, magkasama. Yung index of suspicion mataas. Kaya yung management is the same as for real nCoV pneumonia. That was already our assumption. Okay? Kasi yun ang importante doon. How are you going to manage it? Di ba? So we were already assuming na malamang nCoV na rin ito. So yun yun.
Patient was managed as nCoV. And nakasunod talaga siya sa pila sa test. And he was the first to be tested.
The only reason why his sample was not sent to Australia was talagang 6 lang yung allotted slots. So, that is the only reason.
And he was number 7.
Pero kung itatanong, sir, yung manifestation nila during the time when they were admitted in San Lazaro Hospital, makikita ba yung difference? Pareho ba silang may lagnat? Or talagang clinical or laboratory test lang ang nagsasabi kung bakit kailangan unahin yung babae? Dun sa manifestation...
Yung laboratory test ang nagsabi kung bakit inunahin sa babae.
Pero yung, ano yung manifestation nila during the time when they were admitted? Pareho ba silang nilalagnat?
I think we already said that, Maris, di ba? Yung babae inuubo lamang, yung lalaki may lagnat. Pero yung laboratory test ang decision nila ng RITM, kaya yun ang inunang isend. At sinunod agad yung sa lalaki. Yeah. Standard procedure natin is to, of course, dispose, bury, or dispose otherwise the body as soon as possible. At sa ngayon, ang hinahandle pa rin natin, of course, as potentially infectious yung yung cadaver and being treated with care. And of course, the cremation will be done as soon as possible.
Oo, hindi naman na kailangan. There is really no indication that that is needed. Ngayon, yung tinatanong yung mga dates, that's very granular. We can just invite back the SLH sa Lazaro Hospital para masagot. Kasi hindi naman namin maalala yung mga dates. Marami kaming iba rin iniisip. So, pwede namin ipa-interview sa inyo si Dr. Solante, Jean Solante, at saka si Dr. Dodi Lopez.
Lahat ng DOH na medical centers, level 2 and level 3 hospitals, ay capable. No? Kasama po yon sa licensing requirement natin. For a level 2 and level 3 hospital, that you should have the isolation facilities to be able to handle infectious cases. So lahat po ng DOH hospitals na regional hospital and medical centers, maaari nilang puntahan. Iba-iba po. Anywhere from, dependent kung sa specialty ng hospital. At least 1 or 2 per hospital. Pero katulad ng RITM tsaka San Lazaro, of course, mas marami.
As of today, meron na tayong nakuhang 74 na contacts nung dalawang pasyente na positibo sa nCoV. At sila po ay nabigyan na rin ng nararapat na advice kung anong gagawin nila with regards to home quarantine. Gusto namin linawin na ang home quarantine na sinasabi natin, ito po ay parang isolation lang din sa loob ng bahay. Ibig sabihin, wala silang privilege na makipaghalubilo sa miyembro ng kanilang pamilya habang binabantayan po sila sa loob ng 14 days.
Although fake news yung nitong weekend, yung nakatakaan doon sa Ilaw, doon sa Manila, pero hindi po na totoong may ganon. Na nangangatog na siya, nagkukumbusyon, at meron po possibility na may NOV. Ano po dapat yung gagawin? Sino po dapat
Ang first responder mo dyan, usually, police. Kasi yung police, nagro-roving sila eh. So, after the police, tatawag yan sa pinakamalapit na local government hospital, sa emergency room. Oh, ay, meron tayo rito ng emergency. Magpadala kayo ng ambulance. At pwede bang dalhin sa ER ngayon? Oh, pagdating sa ER. Pero ang problema mo nga, dahil unconscious, aantayin mo na manumbalik yung kanyang malay tao. At the usual, mag-i-interview ka at yung atin assessment tool, yun ang paiirali natin, yun ang gagamitin natin. Pero titignan muna kung meron symptoms. And then, you have to be guarded. Okay? Pero fake news.
Hindi pa nakatanong uli. Sige.
Dun sa PUI na reported today, may nakitaan tayo na sa contact tracing, may nagkaroon ng, may senyales ng symptoms ng ubo at sipon. At ito ay nakasama na sa bilang na ating rinireport ngayon. 8.
Next question. Wala na. Rafi, we have 2 more questions.
Parang quarantine facility ang POH para kung sakasakali may mga dumating pa. Parang kahapon lang naman yung usapan, sir. Pero kung may dumating pang galing sa SARS, yung Chinese and saan po natin yung mga pasyente or yung mga Chinese sakasakali. And
Mababalik din sila, syempre.
so hindi na sila i-quarantine dito, sir.
Chinese nationals. Since yesterday po, lahat ng Chinese, actually foreign nationals coming from China, it was immediately implemented by the airport authorities and immigration. So wala na pong nakapasok, binalik po sila sa pinanggalingan nila.
Pero do we have a quarantine facility in any case hindi pwede sa bahay or
For aling pasyenteng pinag-uusapan natin da?
Quarantine facility
For-
in general? Of course, the isolation in the hospitals if they're asymptomatic. But what you are probably referring to in particular is the planned repatriation of about 40 to 50 Filipinos who are now in Wuhan. Is that the correct way to rephrase the question? Okay. Now, we are going to present the options during the task force meeting with President Duterte tonight to give us the guidance because I'm not yet at liberty to tell you what these options are, what these quarantine facilities may be. But suffice it to say that we need to prepare everyone, even the communities where the quarantine facility will be situated.
Mukhang community acquired talaga na mixed infection. Pero tama ka, Jovic, no? Yung parang last 3 days, medyo stable yung pasyente. Kaya lang biglang nag-deteriorate yung kanyang condition. Of course, gumagawa pa rin naman sila ng clinical audit ngayon sa ospital para mas examinin kung ano yung nangyari at saka intindihin. Pero ang pag-report sa atin ay parang ano siya, community acquired yung pneumonia. Well, sinischedule na namin yung kanyang cremation and siyempre lahat ng precaution gagawin naman natin para sigurado na walang possibility ng exposure ang kahit sino na ma-involve during the cremation. Aiko?
Dalawang negatibong test results ang kailangan natin. Yan ang asa protocol, yan ang standards. Kaya yung babae na iniulat natin nung una na first case of nCoV, hindi pa rin natin pwedeng paalisin dahil hanggat hindi na-satisfy yung 2 negative test results, tsaka lang natin siya pwedeng paalisin.
May time frame ba yun kung kailan yung susunod na test dapat sa kanya?
24 to 48 hours between the 2 tests. Yes.
Follow up na po, sir, dun po sa mga PUIs na nailabas sa hospital or mga po self-quarantine, pero hindi pa po sila pinapayuhan na makisalubungka sa mga
Ikaw na kaya?
Yung mga pinauwi ng 10, although we are encouraging them to still be conscious ng kanilang kalusugan, pero sila po ay na-clear na at ang base sa kanilang laboratorio, negatibo sila sa nCoV.
Huling tanong.
Doon sa una mong tanong, wala pang, hindi pa yan finalized. Kasi nga, gaya ng sinabi ko kanina, ibibigay kay President Duterte for his guidance. Kung Fort Magsaysay ba or there's also an island being considered for the quarantine facility, but there is nothing definite. Yung pangalawa naman, sa Taiwan, we will have to make the adjustments in the Interagency Task Force on Emerging Infectious Diseases. We will convene this afternoon. So this is one of the considerations.
Sir, sorry pahabol lang. Sa Thailand kasi meron daw nakita na apparent success in treating NCOV by using drug cocktails.
HIV, AIDS.
Oseltamivir with lopinavir and ritonavir. And apparently yung nag-positive daw initially sa NCOV within 48 hours ay bumuti ang lagay. How are you seeing this, sir, as a possible cure for NCOV?
Well, mukhang this is a combination of antiviral. The oseltamivir has been proven to be effective for influenza A virus, AH1N1, and the all other types of influenza A virus. Now, the other two that you mentioned, they are for the HIV/AIDS patients, no? But if they say that there seems to be an improvement after 48 hours using this, that is probably anecdotal, as Yusek Eric is saying. Anecdotal because you have to remember that there are 80% of cases now in China are considered mild. And so the possibility that they are recovering very quickly is very high. 21% severe. So baka yung nakuha nilang pasyente, ito yung andun sa mild. Kaya siguro nagpapakita ng signs of recovery concomitantly with the combination therapy. But there is no hard science to prove this anecdote or this theory. It's a theory, they're saying. So let's wait. WHO, I and Rabi discussed that lengthily yesterday. So there's no science to prove it as of this point.
So, pag matindi, pag severe, parang hindi pa siya.
Yeah, yung sa...
Cannot say.
Wala, it's really hard to say. It's inconclusive. There's nothing.
Last two questions, Aiko and then Trish. Sige, Aiko. Talagang last na talaga ha. Meron pang execom kami sa taas.
It's very clear, and I categorically state that two are imported cases. And the one who died is in statistics for China. Okay, that's not for us because ours, zero local transmission.
And the last question.
And then showing all signs or symptoms, and then the patient refused to be admitted. Pwede po ba yun? Or does the hospital reserve the right to hold the patient if the patient refuses to be admitted?
Since you have paltry, paltry information, it's very hard to answer that question because we need more information to make any suggestions of whether there is a breach of protocols. But obviously, we are bound by the law on the Disease Notifiable Act. And if this particular condition fits in the category or the criteria for which you consider it as a notifiable disease, then it's their duty to report. Pero kung, well, let's keep it at that because we don't have much information. And they can.
Okay. See you tomorrow. Thank you.
Araw-araw na kung tayo dito.